name is Gwen Jackson, and I'll be conducting an assessment of the cranial nerves, the head, and the neck. I have my good friend Thomasina, who has volunteered to be my patient for today. Hey, Thomasina.
Hey, Miss Gwen.
When I'm starting an assessment, I will come in and basically, of course, I've washed my hands, but I will introduce myself, my name, and my title so that my patient don't confuse me with another discipline or a physician. So, I'm doing the cranial nerves. With that being said, I'm going to start with cranial nerve number 1, which is the olfactory, or the sense of smell. I have 2 items here that I'm going to let my patient smell. She's going to close her eyes and take a whiff. So the first one, close your eyes.
Vanilla.
Yay! Ding, 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 ding! She got that one right. Now this one here, I'm going to tell her don't take a deep breath, but just kind of inhale it because it is an irritant. Oh, black pepper. Ding, 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 ding. She is correct. The second cranial nerve is the optic, and I will do that by testing visual acuity. And visual acuity, I don't have a Snellen chart, but I will explain it. You have your patient about 20 feet away from the chart. Each line on the chart indicates a visual field. The patient will cover up one eye and basically identify a character or a letter. If they get all those right, that line that correlates with that acuity will be the number. So if you can get the big E, then, well, no, at the little bottom row. If you get all those correct, that's a 20 or something. Anyways, so I don't have that, but that's the way that the visual acuity is done. And of course, since my friend here has on glasses, I know she has regular ophthalmic exams, and I would assume that her visual acuity is 20/20 with corrective lens. Optic nerve 2, visual acuity, and pupillary response. So I don't have my pen light, so I will start by testing her pupillary reaction to light. And let me get the battery pack on here so that I can have enough charge. And I don't. Did I do that right? And on this ophthalmoscope, I don't have enough charge, so you always have a standby. I will use this one. No, we ain't starting over. Bright light, pupillary reaction. Okay, can you take out your glasses? And basically, I'm going to shine the light. I will look at the size of her pupils prior to shining the light and after. So I'm looking, and they are a size 4. And they constricted down to a size 3. And I will do it on both sides, 4 and 3. And looking at her eyes, I see that her pupils, they were equally round, they weren't asymmetrical, and they did react to light and accommodation. So that is the measure of her pupils, which is cranial nerve number 2, the optic. Next there is cranial nerve number 3, which is the oculomotor, and I will do that. Basically that consists of the pupillary reaction, and we've done that. Hers equally round and reactive to a light accommodation. It's size 4, constricting to a 3. So I would do extraocular movements, and that is done by the patient following my hand. So she will basically follow my fingers in different gazes. And of course, I've done it. She has followed. Her extraocular movement is intact. That is cranial nerve number 3, cranial nerve number 4, which is trochlear, and cranial nerve number 5, which is trigeminal. Trigeminal is basically done by, you have a sharp object and a dull object, and you will poke that in 3 different areas on the face. And the patient will then identify whether the object is sharp or whether the object is dull. So I will get my pen. This thing keep falling out. Ouch. I poke myself. In addition to using this, I will do jaw movement, and move your jaw up and down, side to side. this facial. So I'm going to now do a little test here. Not going to do it lightly. I want you to identify whether this is dull or sharp.
Sharp.
Yep.
Dull.
So she can identify, and I'm well aware that you do this in 3 different areas on both sides of the face. So this is the test of the facial nerve. Next will be, no, did I do? No, that's trigeminal. Abductions. So the abductions is extraocular facial move, I'm talking too fast. Extraocular movement, and she did follow, and she did fine on that. Next is facial, and the facial consists of puffing air into the cheeks, moving your eyebrows up and down. What else does a facial consist of? Frowning and smiling. So, and she's done all that. But there's another thing that you do with the facial is basically she closed her eyes, and basically she fight against me trying to open her eyes. That was another thing. And I didn't do that. So basically I want you to close your eyes, and as I'm going to try to open them, but I want you to try to keep them closed, okay? And she passed that too. So that's the facial nerve, which is cranial nerve number 7. Cranial nerve number 8 is the acoustic, and basically it's how well you can hear. I would do that with the Weber, by doing the Weber test and a Rhine test, and speaking in a low tone. And I will say hello to my patient and see how they respond. Hello, nurse. She said hello back. So she did hear me. Basically with the Weber test, I will tap the tuning fork, place it on the top of her head, and she should tell me as to if she can hear out of her left ear, her right ear, or both ears. So I will tap it and then place it on her head.
Both.
She can hear it out of both of her ears. And you heard it.
I have good ears.
And then I will do the Rhine test, and basically that's where you place the tapped tuning fork behind the ear, and they will tell me when they no longer hear the sound. And once they don't hear the sound anymore, I will place the fork on the shoulder for them to feel the vibration. Right. I'm thinking way ahead. You tap.
Okay. Yes.
Alrighty. So the tone was gone. She felt the vibration. So her acoustic, which is cranial nerve number 8, is intact. Next is the glossopharyngeal, which is the gag reflex, swallowing, voice, and uvula. I've talked with her, so I know her voice is intact. Do you have your gag reflex? And she swallows fine. And of course I would look in her mouth, say and her uvula is intact, and it's dangling, and it's there, and it's not deviated, and it's not swollen, and it's not discolored. So that's cranial nerve number 9, glossopharyngeal. Then there's cranial nerve number 10, which is the vagus. It's the voice, speech, gag, and swallowing, which is the rise of the palate. And we just did that with the previous cranial nerve, glossopharyngeal, which is all intact. Cranial nerve number 11 is the glossopharyngeal. No, it's not. It's the spinal accessory muscle. And basically, you look at the trapezius muscle on the back, and it should be symmetrical. A test for that is to bear weight on both of your patient's shoulders, and they should, as you're pressing down, they should be pressing up. And if they can do that, that spinal accessory muscle is intact. So I'm going to press down, and she is pressing up. So it's intact. Spinal accessory muscle, cranial nerve number 11, unremarkable. Last but not least is the hypoglossal, and that's the tongue symmetry. And the articulation of words. So because I've talking with her and I've seen her put her tongue out, everything is intact. So I went over the 12 cranial nerves and they were unremarkable. I will now go over the lymph nodes and I will start that palpating, of course, and I'm feeling for swelling in addition to my patient's response. As I'm palpating, if there's some tenderness, there will be a jerk or something from the patient. So this is pre-auricular, and then I'm going to go around to posterior auricular. It's behind the ear. Then occipital is at the base of the skull. Down here is tonsillar. That's kind of at the mandible. I'm going down under the jaw. That is submandibular. Then coming around here is submental. Then come around here at the sides of the neck is superficial. Coming here towards the back is posterior cervical. Going down at the shoulders kind of deep is the deep cervical chain. And number 10 is supraclavicular, which all of her lymph nodes are intact. There's no swelling and there was no response by my patient in regards to pain. I will next do her reflexes, and that's the brachial radius, and that consists of her hands laying on her lap, basically supporting her arm here and lightly tapping the radial here. And she did flex and kind of jerk up. So that's intact. Patellar, have your patient with their feet off the floor. If their feet are on the floor, you can have them cross and strike the patellar tendon, and you're looking for two things with that. You're looking for the quadricep muscle here to tighten up, as well as a jerking motion from the patellar, striking the patellar tendon. And it did it. It kicked and it did tighten up. My thing here needs to be put back together. So I did the tendons. Now I will look into her ear and test her ear. Look into the auricle, and I am looking for any foreign object, any liquid, and I'm also looking for the cone of light, which is a good thing. And with the adult, you always take the earlobe and pull it up. And I am looking there, and I can see the cone of light. There is no drainage in her ear. And then I'm going to look in her eyes, and I also need to look in her mouth. Look in her eyes. And basically with this, I am looking for retinal hemorrhage or any other disease process. Unremarkable. No evidence of a retinal hemorrhage. And of course I will come around, and for time's sake I'm not going to do it, but I will look in the other eye, and whenever you look into the eye, you have the same eye hand on that, holding the light source on that side. I will now, I'm going to palpate your sinuses. So, we're going to do this. Make sure it ain't all in your eyes. And there is no pressure there, and she's not jerking, which identifies there's no pain. What did I miss? Oh, memory. Could you tell me your name?
Thomasina.
And where are you? What city are we in?
Little Rock.
And what year is this?
2011.
And who's the president?
Obama.
Alrighty, so I've got her level of conscious. She's alert oriented times 3. Her head is symmetrical. Her hair is dispersed appropriately without any thinning. There are no masses or scars on her face. Her pupils are equally round and reactive. Her mouth and looking is moist. It's not dry. Say ah, so I can see your tongue is midline, teeth, gums. Intact, gums are pink and moist. So I have completed a complete cranial assessment, lymph node assessment. Oh, I forgot to palpate her neck. I did. Her throat, I've done so many takes of this, I promise. But I'm going to test her neck. And this is her thyroid. and it's fine. And her trachea is midline. So I went down my list. Cranial nerves intact. No lymph node swelling. Deep tendons are intact. Mouth is in okay. There are no lesions, loose teeth, or any growths. And I think that concludes my assessment.